Okay, good afternoon. I think I'm the last speaker for the session. This is a little different from the previous talks, and this is like an excerpt from the talk I gave at the Cornea Society. Evolved because originally it was supposed to be a Philippine experience, of growth, and then because we had a difficult situation last year, it became lessons learned. So I'd like to share our lessons learned. Briefly, our iBank was founded in 1994. It's a non-government, non-profit foundation. There's us, all of us much younger then, with Frederick Griffith, who was then the chair of IFETB, 50 square meter space in 1995, and now we have over 100 square meters at the Philippine General Hospital, and we have a full facility at iBank. From 3 employees in 1995, we grew to 30 employees in November 2012. Our iBank, as Samar talked about earlier, is I think one of 2 iBanks in Asia that can share tissue. Locally, we are actually the main. No, there's not. We actually supply tissue to the entire Philippines. We're based in Manila, but as the arrow will show, we send tissue all over. We do this because we have tie-ups free of charge that we can send tissue free of charge to all points of the Philippines, our couriers and our airlines. And some of the airlines also transport tissue free of charge to other countries. As of last year and early this year, and still a little bit this year, we're sharing tissue with these countries. Basically, it's been a history of growth. And total tissue process is over 18,000, and our utilization is quite good. It's 79.24, 56% optical, 20.7% therapeutic. We have several game changers, but I'd like to concentrate on particularly one. But among them were our partnership before with the IFETB. Then we have this important law that was passed in 1995 and the support of the medical legal division of our police force, which is like the coroners. We have support of our airlines and couriers, which allows us to transport our tissue free of charge all over the country. And Lamera Keratoplasty has helped us utilize our tissue and have less wastage because we can distribute even tissue with poor quality in certain parts, as we all know. Support media and celebrities has been very important, and now I think the ACS and the IBA is another game changer, which we have yet to maximize. But I'd like to concentrate on this, because this has been a blessing, but it has also been a source of our problems, and this is one of the lessons learned. We are one of the countries in Asia, I don't know of any other country, which has a presumed consent law. But let's first go back to IFETB. They helped us establish our iBank, get trained, etc., and achieve international standards. And international sharing is very important to us because locally we fully subsidize all our charity patients. Processing fees are waived, and 52% of our patients served locally are charity patients. For our private paying patients, we still partially subsidize the processing fee, and we receive no government subsidy whatsoever, unlike Brazil that gets 100% and India that gets 20%. So we have to do everything ourselves. And, well, as further pursuit of excellence, we got ISO 9001-2008 in October 2012. So we are very serious about our process. We are financially stable. We've organized ourselves like a corporation. Now, way back in 1994-95, in order for us to be taken seriously by the IFETB, we had to pass a presumed consent law for autopsy dissidents, patterned after the Maryland Coroners Act, that would allow the iBank to retrieve corneas in certain autopsied cases without consent. These are unidentified, unaccompanied dissidents, or where there is a consent for autopsy without any written objection to corneal retrieval. This was necessary then because of our anti-donation culture. There had been 5 to 6 attempts at iBanking in the Philippines since the 1940s, and all of them failed because of a lack of dedicated leadership and an anti-donation culture at the time. Ours was a fascinating, if not frustrating, story, and this was one of the reasons we had to pass the law. The idea of the law was to jumpstart the iBank, while our Department of Health would help encourage voluntary donation. However, this did not happen. And despite major inroads in acceptance for corneal eye donation, only 20% of donors are from non-medical legal dissidents from hospitals and funeral homes with family consent. And there's no organized Department of Health campaign for organ or tissue donation. And the iBank is virtually doing its advocacy work on its own, which can be very expensive. This is the situation. Now, it has worked for us very well. If you look at the statistics, it's like a surgeon's dream, because most of our cases are autopsied cases, young people who die of sudden violent deaths. 89% of donors are less than 50 years or less than 50, with majority in 20 to 39 years old. And these are the most common causes of death. And as you say, it's like a surgeon's dream. However, the bad side to all this is that people became lazy to work on the hospital retrieval program, and that was a major problem for us. And unlike in the U.S., where autopsies are done in privately owned funeral homes spread over unlike in the U.S., where autopsies are done in the coroner's offices, government buildings, or maybe limited areas, the autopsies done in the Philippines are done in privately owned funeral homes spread over, at least in our case, 650 square kilometers, not in any government or central morgue. Therefore, we have to deal with so many entities, and cars and gasoline are among our iBank's biggest expenses. We don't just deal with one hospital, we don't just deal with a central morgue, we have to deal with all these private funeral homes, not just in Manila, but around Manila, north and south. Now, after 17 years of this, you have to deal with the iBank staff, the police, funeral parlor owners, and personnel. There are so many groups involved in operations, and this is a source of potential problems in a smooth implementation of a law, which really needs smooth implementation in order not to run into any problems. And after 17 years, you're bound to run into a problem. So, this is the problem. Last August 2012, this is a horrible headline, which is very misleading and inaccurate. We had a medical legal case. An 18-year-old man was stabbed to death and autopsied, and there was no objection to retrieval of corneas, and the corneas were retrieved. But I don't want to go into all the details, but to make a long story short, the donor was related by affinity to a very noisy media person who decided to make the iBank her crusade and try to make the iBank appear like we were evil people who were stealing eyes. And we were called all sorts of names, eye snatchers. Things were spread like we had to crack open a head to get eyes. So there was a lot of miscommunication being spread around, and it became even more absurd when we were being suspected of being a syndicate that actually were responsible for disappearances of people just to get their eyes. It became like a very horrible witch hunt. And at this age, I was cyberbullied. Okay. I know what it is now to be cyberbullied. So it was a nightmare. And the miscommunication, the hysteria, irresponsible media led to this, because we were very dependent on the presumed consent. And our headache was felt throughout the Philippines, to Korea, to Cairo, to all the countries where we shared our tissue. From as high as 243, we were down to 53 corneas in October. So that was quite bad. And so we had to stop sharing with certain countries for a while, because we had to first fill our local needs. I was explaining to Tim, why did it affect us so much? It's because a majority of our tissue was from presumed consent cases, and this particular case was from that kind of a case. And even if our people and the police and the medical legal officers were doing something legal, there was a chill factor, because they became so afraid, and they saw how media could twist something to make it appear bad when it was actually legal and not malicious. So that we had to sort of, there was a look-see thing. So from a really high, fast growth, but being dependent mostly on one type of tissue retrieval, we had this crisis, a very painful crisis for us actually. But again, a lot of lessons were learned. For presumed consent act for corneal donations to go smoothly, frequent education of partners and checking of details is necessary. It is also best not to rely on this as a main avenue for corneal retrieval, and I think HCRP is the way to go, and we are trying to build that now. It is not for the faint of heart and bad for health. I know it's really bad for health, and it does not breed goodwill. You must make a lot of noise lest people forget your good work. As doctors, we're not used to tooting our horns. We just do our work. But it is necessary, especially in the age of social media. We have to also learn how to utilize social media for the cause. In fact, we have an iBank fan page, Facebook, etc., etc. Utilize your website because it is one inexpensive way to get the message out there and to counter bad PR. For NGOs that have taken the lead role, such as us in iBanking, don't let government off too easily. If any NGOs out there planning to put up an iBank, you have to really make sure government is committed to it. We have learned that the hard way. We have to, government gives us lip service, but they have not done anything really to help. Of course, have a good lawyer and crisis manager. And your track record is important. We have some, silver linings. And one thing we're doing now is we are strengthening the HCRP. We are turning autopsy dissidents into consented. We are doing more community outreach and more social media active. And there's a bit of a rise now in our tissue again. Last thing is that we also realize, and we have to remember as surgeons and as eye bankers, that corneal tissue, no matter how small, is not just tissue. It belongs to a human being who belongs to a family. This is an actor who donated his son's corneas, and we always have to remember that, because sometimes we tend to forget. We describe it as tissue clarity, etc., age, etc., etc. It still belongs to a human being, and he is mourned by their family. Sometimes we forget. And with that, I hope this has been a lesson to us. We're learning from it, and we hope to become stronger and grow with maturity from this lesson. Thank you very much.